Hello everyone, my name is Andrea and I will be discussing the role of policy and law in healthcare. What is going to be discussed is the role of health policy and the law in today's society, why policy making is needed, and the problems with policy and law. Policy and law are defined in different ways. Policy is the framework with what a government wants to attain and the methods and principles it will use to accomplish them. Laws are set standards, procedures, and principles that have to be followed. If a law is broken, those who broke it will be held responsible and arraigned in court. Role of policies. Policies in healthcare are extremely important. It sets a general plan of action used to guide anticipated outcomes and is an essential guideline to help make decisions. The purpose of healthcare policy and procedures is to link the desired outcomes of the organization to the employees. They help staff understand their roles and responsibilities inside that specific organization. In the healthcare setting, specifically, the desire for policy is to set the foundation for the distribution of harmless and cost-effective quality of care. Examples of this would be medicine handling policies and providing care policies, as well as HR policies. Medicine handling policies inform the staff on how to handle, maintain, and distribute medicine to patients. They also regulate what medicines are going where and how they are being tracked. Providing care policies. This policy covers nutritional guides, patient and family education, abuse and neglect, admission and discharge, patient callback, patient rights and responsibilities, as well as numerous other topics. The policy changes per department. For instance, the pediatric ward would have a separate set of policies compared to the cardiology ward. HR policies. They're there to improve the skills of staff, implement strict guidelines, and follow hiring and firing procedures. The role of laws. Whenever there is a new law implemented, there must be policies created and distributed to staff. For example, this would be the employee handbook. Laws are there to keep us safe. In an article I read, it stated, everybody hopes their doctors are aware of current laws and ethical concerns in healthcare. After all, without these guidelines, medical malpractice would go unpunished, and more importantly, lives would be lost. Examples of this are HIPAA, false claims law, anti-kickback law. HIPAA, as we know, is privacy in regards to medical treatment, records, and it also provides the ability to transfer and continue health insurance coverage when workers change or lose their jobs. It reduces healthcare fraud and abuse, and it mandates industry-wide standards for healthcare information on electronic billing and other processes. False claims law, it covers fraud perpetuated against the government. Anti-kickback law, this federal law prohibits the exchange or offer to exchange of anything of value in an effort to induce or reward the referral of a federal healthcare program. Why do we need policy making? Written policies are implemented to reduce confusion, chaos, and legal problems. Policy making helps with decision making under a specified set of circumstances. Help gives direct instructions and guidance to the laws an organization must abide by and follow. Problems with policy and law? Well, they're ever changing and they're hard to keep up with. HIPAA and data breaches occur, false claim suits, anti-kickback issues, labor and employment issues. These all are an issue if the policies are not followed, therefore people are breaking the law. Conclusion and biblical perspective. Healthcare policy and law is in place to prepare and protect healthcare workers and the outcomes for patients. Policies give a general plan of action so laws can be followed and prevent illegal issues. Laws are implemented for the safety and well-being of both patients and employees. In James 2:10, it is stated, "For whoever keeps the whole law but fails in one point has become accountable for all of it." To me, this means that God put policies, as in the Bible, in place so that we would know what is right and wrong. If we choose to not follow the policies implemented, then we must be held accountable for our actions. Our government and healthcare systems do the same. They give us the policies and procedures we must abide by, and in return, if we break them, we likely are breaking the law as well. Thank you for watching my presentation. Here are my references.